We now move on to the next keynote address. For the next 14 minutes, I'd like to invite Professor J.S.S. Rulz. He's a senior consultant neurosurgeon and a researcher from Barcelona in Spain, and he'll be speaking on cardiovascular risk factors and cognitive impairment as a reflect of silent brain ischemic damage.
Okay, good afternoon. And with my talk, I will show you another connection between mind and heart. In 1999, Peterson introduced the concept of mild cognitive impairment. Today, it's recognized as a nosological entity as appears in the DSM-5. We distinguish two kinds, amnestic mild cognitive impairment and the non-amnestic mild cognitive impairment, depending on if the memory is affected or not. And the important thing of this entity is that it has a 10-15% annual conversion rate into dementia. This is a German study published a couple of years ago in which patients fulfilling the criteria of mild cognitive impairment, more than 22% become demented after 3 years. Then, in the past, we have a brain at risk that develops dementia. Today, we have this intermediate stage. We can detect the patients in this intermediate stage with cognitive decline associated with vascular diseases that we can stabilize or even revert and normalize, and the most important, avoid the development of dementia. What are the pathophysiologic mechanisms of mild cognitive impairment? We talk of vascular mild cognitive impairment when this mild cognitive impairment happens in a vascular risk patients, with the vascular risk factors, genetic factors, age, lifestyle that induce all kind of large vessel occlusion, that is the origin of large cortical infarcts. The most important, the small infarcts, the silent infarcts, the infarcts that are not eloquent, they are the most common cerebral infarctions, because in these cases, apart from the vessel occlusion, there is a small artery disease, and also the hypotensive is. All them induce brain atrophy that are the consequences of vascular cognitive impairment. The prevalence of vascular cognitive impairment is in two-thirds of stroke patients experience cognitive impairment or decline following a stroke, and the risk of developing dementia is 10 times greater among those with a stroke than without a stroke. But the important thing is that 75% of elderly have vascular changes in imaging. What kind of changes? The majority of these changes, only we can detect it when we study with MRI as lacunar microinfarcts, white matter lesions, and microbleeds. Then, important data. This study that was published in Stroke in 2013, and according to the Framingham Risk Score, even young adults aged 35 to 44 years with a cardiovascular risk profile, they have cognitive impairment. And in the conclusions, the authors concluded that there is a need for further investigation of cognitive function as a new clinical endpoint in the light of cardiovascular burden. Recent studies show to us that cardiovascular risk factors are associated with smaller brain volumes in regions identified as cellular predictors of cognitive decline, as the hippocampus, the medial lobe. Then, stroke, both silent and clinically eloquent, is one of the most important determinants of dementia. And I have to say that silent strokes are one of the most important determinants of mild vascular cognitive impairment. Because the microinfarcts are very common. And we cannot forget that they are associated with a small vessel disease, that is a compromise of cerebral circulation. In clinical pathological studies, the presence of small or microinfarcts at cortical and subcortical levels is highly frequent, and the association with cognitive impairment is very strong. The prevalence of cognitive impairment after a stroke remains persistently high over time, and I'm talking about eloquent strokes. But even in patients with transient ischemic attack, 1/3 of those patients must COP criteria of cognitive impairment even 3 months after the TIA. And even 11 years after ischemic stroke in young adults, they have cognitive impairment affecting different kinds of cognitive functions as processing speed, visual construction, memories, attention, executive functions, etc. And which is the treatment? Treatment is to act on the modifier risk factors, non-pharmacological therapies. For example, exercise improves the cognitive function, and there are some pharmacological treatments. The non-pharmacological therapies, as I say, the program resistance training, cardiac rehabilitation exercise programs improve the cognitive function, and cognitive intervention programs, as simple as do crosswords, read books, etc. Among the proposed pharmacological treatment for patients with cognitive impairment, there are several kinds of drugs, but unfortunately few of them are effective. There was a very nice study with vitamin B12 supplementation showing that in that patients, the administration of vitamin B12 slowed atrophy of the hippocampus. Ectopegin, a molecule that is available in the Russian sphere countries, cerebralizing, ginkgo biloba, and piracetam, could have positive effects in mild cognitive impairment. Omega-3s, no. But also, the most used drugs in the treatment of dementia, as the cholinesterase inhibitors, for these stages of mild cognitive impairment should not be used. Then we have another kind of drug, the cholinergic precursors. Among them we have 2, cholinol phosphorate and citicoline. Citicoline, that as one of his components, the choline part, is used for the synthesis of acetylcholine, that is the neurotransmitter involved in cognitive functions. And there are some experimental experience with this drug, as this Cochrane Library review, showing a positive effect on cognition and behavioral disturbances associated with chronic cerebral disorders, mainly vascular, in the elderly. Studies with long-term improving the post-stroke cognitive impairment, especially in attention, executive function, and temporal orientation, even 1 year, after 1 year of treatment. And recently, the same authors published the follow-up after 2 years with a clear improvement in the quality of life correlated with an improvement in global cognitive impairment. But important is this study made by a team of Italian geriatricians in patients fulfilling the DSM-5 criteria of mild vascular cognitive impairment. These patients were randomized. One group received citicoline and the other group no. And using a scale as easy as the mini mental state examination, you only need 5 minutes to pass this scale, they discovered how with an effective treatment we can stop the cognitive decline, even improve a little. But the interesting finding in this study was in the non-treated, apart from the control of the risk factors, this was not enough and was a persistent and continuous decline of the cognitive function, losing an average of 2 points in the mini-mental. That means with there are effective strategies that we can stop the cognitive decline and, as a consequence, delay the appearance of dementia. And this is a proposal for an empirical approach to mild cognitive impairment at primary care level. Then, and to finish, take-home messages. In previous talks has been demonstrated that with a population is aging in the world, and with this aging population and uncontrolled cardiovascular risk factors, vascular cognitive impairment is expected to rise and be an epidemic. You must identify persons at risk of cognitive impairment and dementia And this whole promise for prevention or postponement of dementia. Use screening tools to detect cognitive impairment in your patient with cardiovascular risk factors. And one alarm sign could be that patient that starts to forget to take the medication. This implies some degree of cognitive function. In that patient, then you should do a cognitive test as the mini-mental, the short portable mental status questionnaire, the MOCA, whatever, to detect if the patient has a cognitive impairment or not. Because it's now accepted that many traditional cardiovascular risk factors are also risk markers for Alzheimer's disease and vascular cognitive impairment. And cognitive function in this relationship to cardiovascular and stroke risk should be screened for in clinical practice, and these risk factors should be treated. And given the high risk of progressing from MCI to dementia, it is important for clinicians to have knowledge of the definition, diagnosis, and treatment of mild cognitive impairment. And that's all. Thank you for your attention.
Professor Ruiz, thank you very much. That's a great, very serious topic, very serious topic. I'm in a long practice in medicine for 40 years. I have been seeing this quite commonly in Western countries, States, as well as, I don't know about India, but I'm sure it's happening everywhere. It's a human, and also thank you for coming all the way from Barcelona to shed light on this very important, extremely critical topic. We have time for questions here. And let me, if you don't mind, I will ask you my first question. There are some programs coming up in the software programs from California and other places where the computer, they can analyze your dementia, cognitive impairment, and they have feedback. They will improve your cognitive impairment. You already talked about exercise and biofeed mechanism and the software that you can wear, and then will give you clues how to improve your cognitive impairment. Your comments on that?
That's clear. There are many ways we can improve the cognitive function. When I say as easy as exercise, that is good for heart, it's good for brain. That is the link between brain and heart. Also, patients, recommend the patients to do crosswords. That's as easy. And then we have some pharmacological agents that can improve. And the most important thing is to stop the cognitive decline, detect this early phase, and avoid the development of dementia. That is good for the patient, good for the family, and for the physician too.
Okay.
That is the important thing.
The common sense things, everyday things you can do without much expense, right? Yeah, common sense things. I think I agree with you. I tell my patients to argue with their husbands or boyfriends or girlfriends or friends, or just argue, debate, If you don't talk, if you don't use your brain, you lose it. I mean, simple common sense, right? Yeah.
Okay. Thank you very much, Professor Rui. Please join the chair.